Good evening, everyone. My name is Rudy Page, and welcome to another prostate health talk on prostate health with Professor Frank Chinegwundoh and Vasco Stevenson. And today we'll be talking about the do's and don'ts relating to prostate health. And as usual, we'll be rebroadcasting this program on Fresh FM Radio London over the next few weeks. So good evening once again, gents.
Good evening, Rudy.
Good evening, Rudy.
Good evening, Vasco.
Good evening, Professor Frank.
Happy New Year.
And to you.
So this year we're going to talk about the do's and don'ts. So I'm going to give you both the opportunity to give us some balance in those do's and don'ts. So, Professor Frank, as an opening, give us one or two of the do's and don'ts as it relates to prostate health.
Yes, if we're talking about do's and don'ts, I mean, these are things that I would say to men every day, because I work as a consultant urologist in London, in Barts Health on the NHS, and also at the London Bridge in the private sector. And I deal with men with prostate cancer every day. And one of the things that men say after they've had a diagnosis is, what can I do to help myself? Sure, you know, I can take the treatments of surgery or radiation or just monitor the prostate cancer. But men are keen to know, what can they do to reduce the risks of the prostate cancer progressing? And I say there's several things that they can do to help themselves. Number one is keeping your weight down. Obesity fuels prostate cancer. So if you're overweight, then get your weight down by one means or another, you know, by attention to your diet. So obesity and the avoidance of obesity is very important. And in fact, it turns out that in terms of developing prostate cancer, the more obese you are, the greater the risk that your prostate cancer will be aggressive, you know, if you were to develop it. But in the main, I'm talking to men who have prostate cancer who are on treatment. So keep your weight down. The second thing that is really important as a do is do exercise. Now, exercise has a direct beneficial effect on reducing the risk of prostate cancer recurrence. Or if you have prostate cancer that's progressing, it'll slow down the progression. And the third thing, of course, is attention to your diet. So having a diet that's less red meat, more vegetables, tomatoes, broccoli, cabbage, pomegranates, Brazil nuts. You know, there are certain foods that some of these complex dietary studies have shown to be of value. And very importantly, vitamin D. The vitamin D story has been around for a very long time, and there's each year that goes by, there's increasing evidence to show that it does, or it's very likely to slow down your progression of prostate cancer and to enhance whatever treatments you may be on. So I say to men, yes, get on your exercise machines, lose weight, pay attention to your diet, and especially if you're living in the UK where there isn't that much sunlight, take a vitamin D supplement. And indeed, the government advised all of us to do that anyway last year. It's quite apart from cancer, it also seems to help in terms of COVID vaccination.
Okay, thanks for that opener. Vasco.
Yes, I agree with what Professor Frank said. Exercise is particularly important, especially a specific exercise known as squatting or Kegels, yes, pelvic floor exercises, particularly good for the prostate. And exercise, of course, helps reduce weight. When I speak to people about weight, I like to talk about certain foods that they should add to their diets, like herbs, for instance, thyme, sage, oregano, basil. These are all known as thermogenic foods. They create heat in the body, which of course burns weight and reduces weight that way. There are two other foods I would recommend for weight loss. If a person eats a grapefruit or half a grapefruit before they have dinner, that reduces the appetite. And so the person, as a consequence, eats less, okay? And of course, the grapefruit, as well, being full of vitamin C, will also benefit the prostate in that way. And there's a food that seems to generate a particular, I don't know whether I should call it a fruit or what, but it generates a lot of controversy when it's mentioned, and that is coconut. And coconut oil, a lot of people don't like it because it's a saturated fat. But there's a lot of evidence that proves that it is particularly good for all aspects of the body, and especially as a fat burner. Because although it's a saturated fat, apparently the body doesn't see it as a fat, but rather as a carbohydrate, and burns it for energy straight away. So you can eat it to your heart's delight, and you don't put on weight, plus other benefits that I can talk about.
Yeah. Okay. So
I just really
yeah.
sorry. I just saw something. We're talking about diet and weight and so on. Of course, they don't just benefit one's prostate. In fact,
of course,
if you look at men with prostate cancer, what most of these men die from actually isn't their prostate cancer. They die from cardiovascular disease.
Yeah.
And so, you know, the Mediterranean diet and keeping your weight down and so on, they're likely to prolong your life over and above the beneficial effects on your prostate cancer.
So one of the challenges, of course, as it relates to prostate, is always around sexual activity, and of course that's what weighs on many men's minds. So, as you two are the experts, I'd be interested in your perspectives in terms of the do's and don'ts.
Well, I'm not an expert. Professor Frank is the expert.
Well,
he did say some very important things there about earlier before you started recording about the regularity of engaging in the sexual act.
Yeah, I think in short, sex is good for the prostate. And I've been following the debate and the controversy and the research on this topic for the last 25 years, and it all comes down to who's done the research and where, and how many thousands of men are involved, and whether you can believe what the men say, and so on. But to summarize it all, I think where we are as of 2022 is that it would appear that the more you ejaculate, the less your risk of developing prostate cancer. And that ejaculation can be within a relationship, or it can be by masturbation. So that seems to be the, and the thought behind that is the more you ejaculate, the more you get rid of toxins that accumulate within the prostate. I mean, that's thought to be the reason. There's also some research to suggest that the more sexual partners you have with an unprotected intercourse, the higher your risk of developing prostate cancer later in life. So when I'm giving talks, I have done for the last 25 to 30 years to groups of men, I say unprotected intercourse is bad. If you're going to have multiple sexual partners, wear a condom. And indeed, there is an association between the STDs, sexually transmitted diseases, when you're young, and the risk of prostate cancer 20, 30 years later. Probably because an STD sets up kind of a chronic inflammatory process in the prostate. And there's increasing evidence that for lots of cancers, that chronic inflammation over many years increases your risk of getting cancer. So this has been shown in the stomach. People who've got this bug Helicobacter that causes gastritis, years later, they end up getting stomach cancer. People who've got hepatitis B, which is an inflammation of the liver, there's a much greater risk of going on later to get liver cancer. And this has been shown for various cancers. And so the STDs when you're young, increase your risk of prostate cancer when you're in that age group, 40, 50, 60 onwards. So I guess the thing would be regular, as a do, regular ejaculations, and if with a partner, stick to one partner.
Yeah, okay. Vasco, is there anything that you want to add to that? Because you've made the point as it relates to zinc.
Yeah.
The loss of zinc. Maybe it would be helpful if you could talk about that. Yeah.
Well, I did say that most of the zinc in the body is in the prostate. And zinc is very important. And even with this COVID we had recently, you'll find that part of the protocol, one of the components is zinc. Yes, we had vitamin D3, citrus fruits, and zinc. Zinc is particularly important in many aspects of good health. But it is also very important for healthy sperm. And it also, believe it or not, helps kill bacteria. Yep. So my take on it is that if you're constantly sending this major component of your seminal fluid into the world, that it could have a detrimental effect on your whole body, but especially the prostate.
Okay, Frank, Vasco mentioned about the pelvic floor. Could you explain that for those people who may not understand what that is?
So the pelvic floor is a group of muscles that essentially keep your internal organs underneath in position. So we usually talk about the pelvic floor more in women than in men, but it does have an important role to play in men. So I describe the pelvic floor muscles as being like a hammock that goes from the pubic bone right through underneath you, ending up in your coccyx or your tailbone. So it's like a sling. It's like a hammock of muscles, and the water pipe will go through a hole in the middle of this hammock, and your rectum will go through the back of this muscle group. And if your pelvic floor is weak, then that will lead to loss of control or difficulty in controlling your urine, such that you would leak urine. Now, women are very, very familiar with this, because whenever women give birth, the pelvic floor gets weakened, and the midwives instruct them in how to do these pelvic floor exercises or Kegel exercises to strengthen their pelvic floors. And many do and many don't. And I often see women who are in their 40s, mid to late 40s, who have got what we call stress incontinence. This is when they cough or they laugh or they sneeze, they leak urine. And then when you ask them about the pelvic floor, they say, "Oh yes, when I was in my 20s, the midwife did mention that I should be doing these exercises regularly, but I did it for a few weeks and then left it." But as everything goes south, as they say, as you get older, your pelvic muscles become weaker, and then you lose urine when you cough. If the pelvic floor muscles at the rear are weak, then you may lose some stool. Now, in men, the pelvic floor is similar in that it runs from the front right through to the back. And particularly the pelvic floor has a role in terms of supporting your water pipe and keeping things in place. So if you have radical surgery, radical prostatectomy to remove your prostate gland in its entirety, due to prostate cancer, the pelvic floor, by the very act of surgery, becomes weakened. And it's very common for men to suffer with incontinence, albeit temporarily, after they've had radical prostatectomy. And so men are taught how to strengthen these pelvic floor muscles to regain control after they've had their prostates removed. It also turns out that your pelvic floor is very important in terms of erections and the ability to get an erection and the ability to sustain an erection. And the better your pelvic floor muscles, the stronger they are, the better your sexual experience. So we do teach men how to exercise their pelvic floor muscles. It's like exercising, and it's like, as I say to men, if you want to exercise your pelvic floor muscles, it's the same as exercising any other muscle. If you want to have huge biceps, you're going to be in that gym for months and months and months and on end, lifting those weights, doing those bicep curls. You don't get overnight results. Okay, and it's the same with your pelvic floor muscles. You can be taught how to exercise them on a regular basis, and that helps you regain control if you've had your radical prostatectomy. And if you're having erectile dysfunction issues, it will help improve that side of things. So the pelvic floor is very important, both men and in women.
So generally, people would know those exercises in the gym in terms of squats, wouldn't they?
That helps, but it's not. That's not actually how you exercise your pelvic floor muscles in a way that's going to give you control over your urination. So so people say to me, how do I know what my pelvic floor muscles are? How do I know if I'm exercising them? Because what you have to do is you have to contract your pelvic floor and then relax it. Contract and relax. And I say do 10 of those 3 times a day. So a set of 10, three times a day. And so the man will say, well, what is my pelvic floor? How do I know which muscles it is? Is it just clenching my buttocks, for example? And I say, no, it's not clenching your buttocks. So how do you learn what your pelvic floor muscles are? So I say to men, there's 2 ways of trying to work out what your pelvic floor muscles are. Number 1, if you're passing urine and I suddenly say to you, stop, hold it, hold it, and then I say, okay, release it. The muscles that man has used to be able to interrupt his stream, that is his pelvic floor muscle. And so the idea is to learn how to recreate that same movement you've had to do to interrupt your flow, but to be able to do that on demand. Okay. The other way I tell men as to how to get to know their pelvic floor muscles is I say to men, supposing you're talking to your boss about something very important, like your pay rise, and you have the overwhelming urge to pass your wind. You clearly can't be antisocial, and because your pay rise is going nowhere. And so what you have to do is you have to hold it. You have to hold it in until it's socially acceptable, and he's gone before you release it. He or she's gone before you release it. Now, the act of holding in your flatus, the act of holding in your wind, that's actually your pelvic floor muscles that are doing that. People think it's clenching their buttocks. That's clenching your buttocks does not stop that. It's your pelvic floor muscles. Okay. So again, what you have to learn how to do is to recreate that same muscle movement down below that you would employ if you're trying to stop yourself from passing wind, and then learn how to do that at will. And then once you've mastered that, then you can contract, you can relax in any circumstance you're in. And the other important thing about the pelvic floor is that for those men, in fact, women as for that matter, but we're talking mainly about men tonight. For those men who have problems of having to go too often to pass the urine, which happens to many men as they get older, or men who have what we call urgency, which is when you get the urge, you want to pass the urine, and there's hardly any time, and it's coming. What's my Nigerian uncles will describe as being pressed. They say, I am very pressed. I'm very pressed to go, and I took that to mean that they really, they've got the sudden urge to pass the urine, and they have to go and release it. Now, it turns out that if you get that urge to pass your urine and you contract your pelvic floor, that inhibits that urge.
Yeah.
And then you've got more time, then you can take your time and actually go into the toilet. So pelvic floor is a very, very important group of muscles that we're not really taught much about. But
I don't know if, sorry to cross it. I don't know if I'm allowed to mention this, Rudy, but it's a very, very good book called Pelvic Floor Exercises by a young lady called Jenny Russell.
Okay.
I don't know if you've ever come across it.
No.
It's a fascinating book. I would recommend it. Yes, highly.
Okay.
Yeah.
Okay.
Jenny Russell, she's a pelvic floor trainer.
Okay. Yeah.
So we send men to see a pelvic floor physiotherapist, for example.
Yeah.
So they can learn how to contract the pelvic floor. In women, it's slightly easier to know the pelvic floor. So what the physiotherapists do with a woman is introduce a gloved finger into the vagina and ask the woman to squeeze on the finger, and that act of squeezing on the finger, that's the pelvic floor muscles that woman is employing. Okay. And you can tell how strong the pelvic floor muscles are depending on how strongly they can grip the gloved finger. In men, it's not as straightforward. In men, what you would have to do is put the finger into the rectum and get them to squeeze onto the finger. But the pelvic floor is very, very important.
So you can really see, if we think about self-care then, and we now say self-care practice for life, particularly being in this pandemic experience we're in. So that's a serious amount of challenges in terms of education for men, isn't it? And access the information, and then to be able to act on it, access and then act on it, and then, as you alluded to, keep it going over a long period of time.
Yeah, but the important thing, in my opinion, is the individual's mindset, because you'll find that there are a lot of people who will, for lack of a better expression, pay lip service to these things. But unless you keep on top of them and encourage them and urge them, they fall away fairly quickly. So
that's
the mindset is important.
The mindset is important, and that's why also people do better if they're supervised doing these things. It's like if you have a NHS physio that's helping you with whatever part of your body needs physio, you tend to make better progress if you have to go and see them regularly, as opposed to saying these are a set of exercises, go home and do them, and and I won't see you again. You tend to have that tail off. Whereas if you're going every week and they're checking your progress and see how your muscles are strengthening, you tend to get better results that way.
Of course. And having somebody else measure your progression.
Sorry?
Having somebody else measure your progression.
Yeah, and motivate you and encourage you.
Yeah.
It takes quite a long time before you see any benefits. You see.
Yeah.
Right.
But of course, it took a long time to get to that stage as well.
Sure.
So the results are not going to be instant.
Sure.
Obviously, it's going to be over a prolonged period of time.
I know, but we want quick fix.
Which again comes back to mindset.
Yeah, we do want a quick fix.
We want quick fix. We haven't got time.
Yeah, but the irony of it is that people would have noticed that there's something going wrong way back in time.
Sure.
But of course, they present at the last minute and expect the quick fix.
Yes.
Fix rather, and this is something that amazes me.
It's true.
Chronic inflammation, low key. But there, you get a niggle here, a pain there. Oh, it's only a little pain. It goes away. It comes back. You ignore it. but then of course the ceiling falls down, doesn't it? And
Yes.
that's when you're diagnosed with the cancer or something like that, and then you want it fixed immediately. So you get the builder to come in and put the roof back.
Yeah.
Doesn't work like that.
Right. So we're down to the last 3 or 4 minutes. So I'm going to ask both of you for one last point each that you'd like to leave with our listeners and viewers as it relates to their prostate health.
Yeah, I would like to say lifestyle changes.
Okay.
Yeah.
Okay. That's
Diet,
good.
exercise, etc.
Yeah, so we're back to the diet, exercise, nutrition, sleep, hydration.
All those things.
You could say a bit about the hydration, Vasco, because I think that always helps when you talk about that.
Yes, hydration is important, very important, because water is perhaps the second most necessary food type that we put in our bodies. Yes, I'm saying air is one and water. And a lot of us are dehydrated. And as we get older, of course, the amount of water in our bodies is about 50% of what it was when we were younger. As we get older, of course, we lose our thirst buds as well. And what would normally manifest as thirst manifests now as hunger. Yep. So we have that inclination then to eat instead of drink. But the evidence shows that if we do start drinking some water, the thirst buds come back. And since almost all the organs are about 70 to 75% water, we have to keep them properly hydrated so that they can function properly. What I also say to some people is, in addition to drinking water, there are certain vegetables and fruits that are mainly water that, you know, they should be eating. From the fruit thing, we're looking at apples, pears, you know, blueberries and other things like that, other fruits like that.
Big green melons.
Sorry?
The big green melons.
Yes, yes, watermelon, yes. Very good for the kidneys, incidentally. Watermelons, pineapples, radishes, all of these are mainly water. But in a different way, because these fruits come with minerals and vegetables as well, fruits and veggies. So I don't think that people should drink 3 and 4 liters of water per day, unless it's exceptionally hot and you've been engaged in some kind of activity. I would say, okay, drink 2 liters, but make sure that you're eating some fruits and veg, because you're also picking up the minerals and vegetables at the same time.
Excellent. You also have many people who deliberately restrict what they're drinking because they have a problem of going very frequently to pass urine, and so they restrict their fluids, which helps to a certain extent. But the thing about concentrated urine is that in itself is a bladder irritant.
Yes.
And so there's a balance which everyone has to find for themselves. For most people, it's around 1.5 to 2 liters. If you only drink half a liter, your urine is very, very concentrated, and that will irritate your bladder. You'll have to go very frequently.
Very frequently.
On the other hand, if you're drinking 2.5 liters a day, your body has to get rid of that excess, and so you'll have to go very frequently. So there's a sweet point, which everyone has to find for themselves.
Do you say a sweet point or sweet?
Sweet.
Sweet.
A sweet spot, not a sweet point.
Sweet spot, then.
A sweet spot.
Sweet spot. Sorry. Yes, that's what I meant.
Because you've been talking about regular sex all night, so you must be onto the sweet spot.
That's probably a good note to this week's program. Right. So, Professor Frank and Vasco, great to see you as usual, and look forward to the next Health Talk on Prostate Health on Fresh FM Radio London. Thank you.
Thank you very much.
Welcome, Rudy.
Yes.
Thank you so much.
Yes, thanks, Rudy. Good to see you, Vasco.
Have a good night, Professor Frank.
Yeah, both of you. Take care.
Bye.